As a breast surgeon, I do get questions about myths that exist out there about breast surgery, about breast cancer, about the different types of surgery. So it's always important for us to clear up these myths so that patients know the correct information. It's a myth that breast cancer surgery or even breast cancer biopsies will make the cancer spread. We do know from multiple studies that once we do a biopsy, we're not seeding or making the cancer move within the breast. And I think people are concerned that once we take the cancer out, because it's microscopic, you may be sort of leaving behind cancer, maybe moving cancer around in the breast. And one of the things that we do know is that when we take the cancer out, especially if we give treatment after, including radiation, we usually will sort of take care of anything that's microscopic. It's a myth that if you have high risk or if you have a family history of breast cancer, that the only surgery that you need is a mastectomy, and that is not true. Patients with high risk for breast cancer, high risk of developing cancer in the future can safely undergo lumpectomies as well. If you are tested for the BRCA genes, we do know that there's a high risk of you developing cancer in either breast at any point, which is why we usually will recommend a mastectomy for those patients. And it's another type of myth that the titanium clips that are used for marking the areas after breast biopsies will cause problems in the future. When you do what we call minimally invasive breast biopsies, which are biopsies done with a needle, usually we will mark the area with a clip. If you do need surgery, that will mark the area, so that area will come out, including that clip. But if you don't need to go back to surgery, if the area is benign, then we can just follow you. And it's a myth that everybody who gets lymph node surgery will have swelling of the arm or arm lymphedema. We do know that obviously lymphedema is a complication of lymph node surgery, but the majority of people will not get it. So before, we used to do a surgery which was called axillary lymph node dissection, in which we would take out all of the axillary lymph nodes, right? Many years ago, we developed a surgery called sentinel lymph node biopsy, in which we only take out the first couple lymph nodes in which we think the cancer will have spread to, and we test them. If those are negative, then we feel confident enough to say there is no need for us to do any additional surgery. And also, it's a myth that if you do get a mastectomy, you don't have to think about the cancer coming back. We do know that the rates of recurrence after mastectomy are lower when you compare them to lumpectomy, but they're still not zero. And so it's important for them to know that they will have to continue follow-up with their medical providers.